Hello, my name is Dr. Joe Childs. I'm a board-certified functional neurologist. Thank you for visiting our site on vertigo and dizziness and balance disorders. What I'd like to discuss with you on this video is our very successful drug-free approach to helping patients that have vertigo and dizziness and balance problems. So if you're suffering with these issues, I think this video is going to be very impactful for you. We use a very successful drug-free, surgery-free approach at helping patients overcome these issues. We use functional medicine, which is functional nutrition, and we use functional neurology. And we take care of some of the toughest vertigo and dizziness cases around. Because the majority of people that come and see us have really been everywhere. They've tried everything, and basically what they typically hear is that nobody can find out what's wrong with them. My doctor has no idea what's happening. They've had all these different tests and these types of things. So if you're somebody that's suffering with dizziness, vertigo, poor balance, and poor balance is very important, and the reason why is I want you to understand that falls are the leading cause of death in seniors. So people that are over age 65, the number one reason why people have accidental death is because of falls. So if you're starting to lose your balance or your head feels fuzzy and you've been to multiple doctors, then I think this video is going to be very impactful for you. So here's the way it usually works out. What happens is typically people, if somebody has dizziness or you start feeling lightheaded or something like that, they typically if it's not real acute and it didn't happen suddenly, they typically will go see their medical doctor, or they'll go see their general practitioner. Their general practitioner typically will maybe run a few tests, maybe some blood work, and then from there usually people get referred to either two places. They're either their ENT, their ears, eyes, nose, and throat doctor, or they'll get referred to a neurologist. Typically if you go to the EENT, they're going to take a look at you. They're going to determine whether the problem is from an inner ear infection or maybe you have some crystals in your ear, things of that nature. If they can't figure out the cause of the problem, meaning they can't really button it down to an inner ear problem, then typically you get referred to a neurologist. And then you get to go to the neurologist and they say, okay, well, we're not really sure why you have the issue. Let's send you out for a brain MRI. And then you come back and typically in most cases, the brain MRI is negative. And a lot of times the doctor's like, we really don't know why you have the problem. Just take these drugs. They'll give you a vestibular or inner ear sedative called meclizine or Antivert. Maybe they'll do some other special testings where you put these goggles on and you look at your eye movements. But for the most part, very often people are told by their doctors, we really are not sure why you have dizziness. We have no idea. You're just going to have to learn to live with it, or you're going to have to take these medications. So the average person that comes and sees us, they typically see us after after many doctors. So that's why I tell you that the majority of people that we see are the very toughest cases to help, because they've been everywhere. They've already tried everything and nobody can help them. So I want to discuss with you today what we do, why we're different, how are we different in helping patients with chronic vertigo, chronic dizziness, balance disorders, and things like that. Well, number one, what I'd like to let you know is we treat these conditions neurologically and metabolically or nutritionally. So we leave no stone unturned in looking for the actual cause of the problem. Why is it that you're having the issue? And so what I'd like to do is talk to you about the different causes of vertigo. Now in this short video I'm not going to be able to go in full detail about it, but I'm going to give you a good understanding of the different things that may be causing your video, and I'm going to talk to you about our unique solution and how we can very highly likely, there's a very high potential that we could potentially be the doctor that could really change your life, help you with your vertigo, and help you with your dizziness. So remember when I said that the majority of vertigo sufferers, they go see their GP, then they get MRI findings and things like that. Typically when they go and get their MRI findings, thank God, the majority of people that come and see us, they have nothing that they can find on the MRI. They can't find any tumors or stroke or any of these these really bad things. So when you look at people with dizziness, there's really two types of causes, or two main causes, or two general main causes of dizziness. One is an ablative lesion. An ablative lesion, or a hard lesion, is the poor unfortunate folks that actually when they get the MRI they say, you see this right here, this is a brain tumor, or you see this right here, you know, you have MS unfortunately, or you see this right here, you had a stroke and this is why you're dizzy. Those are hard ablative lesions. The majority of people that go and get the imaging because they're dizzy, they don't have those types of issues. Again, thank God that you didn't have that if that's the case for you. The other type of problem is a physiological lesion or a physiological problem, meaning that your brain and your nervous system, you know, your brain and your nervous system is intact. They can't see anything on the MRI, but you still are having symptoms. So there's something physiologically wrong with the way your brain, nervous system, and inner ear or your neck all together is functioning, and it's giving you a distorted sort of view of what's happening in the world. You feel dizzy, or you feel like the world is spinning, or you feel like you're spinning, or you feel like you're veering, or you feel like you're tilting when you walk, or something like that. So let's discuss some of the main causes. So we can break those non-really hard, serious pathologies, or what we call physiological pathways, into really two types. We have a peripheral type of pathway issue, and we have a central-based problem. A peripheral problem means it is the inner ear or the nerve connecting your inner ear to your brainstem. And then the central-based problems are the connections from your inner ear into your brainstem up to your brain. So when our inner ears, what they do is they sense where we are in space. So if I tilt my head back like this, or I tilt my head like this, or I rotate my head like this, or I shift or translate my head like this, I have these inner ear sensors which send messages into my brainstem through what's called the vestibular nerve and into my brainstem and up to my brain to let me know where I am in space. And we really take this for granted when we have good balance and when we have good posture and we feel like we're not spinning and we're not veering and all these types of things that these types of vertigo and dizziness sufferers deal with. Those systems are really working very well, okay? So you can have problems with the peripheral part, which is the actual inner ear itself. There's really three big main causes of peripheral-based dizziness or vertigo. There's more than three. In fact, one of the big reasons why doctors have such a hard time with vertigo, you know, vertigo is the number 3 reason why people actually go in to see a doctor. The third biggest reason. So the doctors are seeing a lot of vertigo, but there are multiple reasons for it, and sometimes there's 2 and 3 reasons for a person's chronic vertigo. And this is why doctors really have a hard time with it, and they usually just give you drugs and medication. So let's go back to the big 3 peripheral reasons. Number 1 is benign paroxysmal positional vertigo, which means that you have some crystals in your inner ear. So this is a picture of your inner ear. You may not be able to see this, but when you look at the ear, we have the inner ear. We have one portion of it, it's the cochlear portion, and that's for hearing itself, and the other portion is the vestibular portion, and that's for balance and orientation of yourself in space. So in your inner ear, you have these 3 canals in the vestibular portion. There's an anterior, posterior, and horizontal canal on each side. So there's 6 total canals, 3 on each side, and what these canals do is they have fluid in them. And when you move your head, that fluid sort of moves and it presses against a sensor and it tells your head where you're at in space. So if I pull my head back like that, my eyes are going to go down and I'm going to stimulate my posterior canal. If I tip my head forward like this, I'm going to stimulate my right anterior canal. So if I tip my head forward, my eyes go up. So these canals will push your eyes a certain way. So sometimes people will have a crystal that will get lodged or get into one of these canals, and what it does is it changes the dynamics of how your inner ear functions, and so there's not balance from one side to the other, and that causes somebody to have positional vertigo. If you roll over in bed, if you stand up too quick, if you turn your head, and you get very, very dizzy for about 30 seconds. Sometimes it can bring you to almost to the point of nausea and vomiting. But it's really not necessarily a dangerous problem. It's just extremely tough on somebody's health and life. Now, these crystals are not like kidney stones. they're not forming abnormally. These crystals are supposed to be there. They're called otoconia crystals, and they're on another part of your nervous system or another part of your inner ear that makes your head go back and forth, or tells you when your head goes back and forth, these crystals are there. But in some people, these crystals break off, they get lodged in these canals, and they cause problems. This is what will happen. Your doctor may try an Epley's maneuver to try to get that crystal out of the canal and in a better place. The only way you can determine which canal the crystal is in is based on looking at eye movement. So we'll put patients in goggles and we'll put them in certain head positions and see what happens to their eyes, and do they develop any nystagmus. So one of the reasons why sometimes you go to a doctor and they can't help you with it is because sometimes the crystal is not in the most common canal, it's in another canal, or you have it in 3 different canals. So in our office, we're very particular at finding the reason why you have the problem. So that's what we call benign paroxysmal positional vertigo. Another problem that you can have is something called Meniere's syndrome. Meniere's syndrome is a swelling of the inner ear. It makes you very dizzy. It's a swelling or inflammatory inner ear problem which causes hearing loss, dizziness, causes ringing in the ear, very violent vertigo attacks, and pressure or fullness in the ear. Now, most doctors, if you go to your EENT and they think you have Meniere's disease, they'll tell you just stop eating salt, they'll give you diuretics, and they'll give you a vestibular sedative, which will really kind of make you worse over time, because a vestibular sedative just shuts down your vestibular system overall, and it makes it very unhealthy. These people that have Meniere's disease, we do a great job with helping patients with Meniere's disease. We do a drug-free approach. Meniere's disease, Google it, it is an autoimmune problem where your own immune system is inflaming your inner ear. These patients need nutritional care way beyond just doing the diuretics and doing the low-salt diet. We have great results with that. Another type of peripheral problem is when you get an ear infection and it infects the nerve that connects your inner ear function to your brain. It's called a neuronitis, and what will happen is typically you'll have a cold or a flu or a viral infection, and now suddenly you get severely dizzy. So these peripheral problems, what will happen is if you get an ear infection, it will shut down your vestibular system on one side, and what will happen is you get very dizzy. Kind of like I'm riding a bike, and if I have both of my hands fairly stiff, my arms fairly stiff, I go straight, but if suddenly I just let go of all tone on one hand, I'm going to spin round and round. Your vestibular system works against each other, and when they're working, this side pushes your eyes this way, this side pushes your eyes the other way. It keeps things very balanced and normal. But if you get an infection on one side, you can get very dizzy. Now, these peripheral vestibular problems can create central-based problems. Central-based problems are physiological dysfunction of the central vestibular processing areas in the brainstem and in a very important area of your brain called the cerebellum, which controls balance, coordinated movements, accuracy of movements, and things of that nature, and also the brain itself, especially the right side of the brain called the parietal vestibular insular cortex. So what happens is if you have these peripheral problems, eventually they develop central-based problems. So what happens is sometimes when people get older, sometimes people, if they've had head injuries, sometimes if people have high inflammation in their diet, things like that, they can start to have dysfunction of the way their brain and central nervous system function. And then what occurs is you can start to get central-based dizziness. There is no drug for that. There's no way you can give somebody a drug that will affect the way their central nervous system functions. As far as making you not dizzy. There's no drug that will go in and fix the problem. We want to address the underlying cause. So in our office, we're going to do very specific testing. Some of you may have had VNG testing where they put the goggles on. We will do that in our office. We don't do the dizzy portion where we put warm and cold air in your inner ears, but we're going to find out which part of your brain and which part of your central nervous system is not functioning well, and why is it that you're having the dizziness. And then we create a specific approach to helping somebody. We do specific vestibular, functional, neurological exercises. So I am trained in functional neurology and I'm also trained in functional medicine, vestibular rehabilitation, and traumatic brain injury care, concussion-based care for people that have had these issues, and we do it without drugs and surgery. So here's a couple tests that you can do at home to see if you have one of these problems. Now, if you already have the symptoms, you know you have one of these problems. But one thing you can do is you can stand with your eyes closed, put your hands out like this, and you should take this finger with your eyes closed and see, can you touch your nose while your eyes are closed? Or are you missing your nose? If you're missing your nose, or you have a little shake to your hand, or you're just missing a little bit, it could tell me that a part of your brain called the cerebellum is not working good. Another thing you can do is you can put your feet close together, completely touching, and what you can do is stand like kind of right in front of your bed, and then just close your eyes and see, are you stable or are you swaying? If you sway or you fall in any direction, well then we know that your vestibular system is not good. You can also close your eyes and do a test called Fukuda marching test, where you march up and down with your eyes closed. You do it with your eyes closed and you try to stay in the same spot. And you should be able to do this for about a minute and not really move. If you start to rotate to one side, you may have a vestibular imbalance, either centrally or peripherally in your inner ear. So what we do is we do a very extensive testing to determine what is it that is causing your problem, and we come up with the approach to help you using specific based neurological rehab. And we also combine that with nutritional care, because sometimes people in their diet, they're eating foods that they're sensitive to, or they have high inflammation. Inflammation is like an overall body swelling or something of that nature, and it can get up into your brain and it can get up into your inner ear, and it can be a big cause of your problem. Most doctors are not trained in functional nutrition and the nutrition approach to helping you. So we have been taking care of patients with dizziness and balance disorders for the last 18 years in our practice. We have incredible success. I have treated hundreds of patients with dizziness and balance disorders. You can watch some of the many testimonials that are on this site. If this sounds interesting to you, if you have dizziness, balance disorder, vertigo, disequilibrium, things of that nature, you have a hard time even just walking through the supermarket, stuff like that, and you've been to multiple doctors and they keep telling you there's really nothing we can do, we can't figure it out, you've had MRIs, things of that nature, well then you sound very much like the type of people that we see in our practice. So here's what we do. I can't tell you everything about what we do in our practice, and your specific set of concerns are probably different than some other vertigo or dizziness balance disorders person's specific set of concerns. So what we do in our practice, since you visited our site, is we do a free consultation where you come in, you sit down, you learn about our practice, you see our facility, and I'll come in, talk with you, listen to what your concerns are, and at that point I'll let you know if I think you're a potential person that we can help. We do that absolutely free. So if you'd like to take advantage of the free consultation, give our office a call, 610-518-3370. It's right on this website here. And give us a call and let our front desk know that you'd like to come in for the free consultation and that you saw us on the internet, on our website. Okay? Thank you very much. Thanks for listening, and we'll see you soon. Take care.
Hi, Janet. This is Janet McAleer. Janet, what kind of health complaints did you have prior coming to the office?
My complaints that I had started with almost like vertigo symptoms. I lost my balance. I was dizzy. I was nauseated just about every day, and many times throwing up.
Wow. And how long did you have this?
You know what? Actually, when I think back, it started actually years ago, a couple years back, but it always kind of left me. But it wasn't until April of 2016 that it came back, and it never left me. Every day I had some kind of an episode, some days being a little bit better than others. Some days were a complete down and out, where you're either laying down in bed or on the couch.
Oh, Janet, and how did this affect, different things in your life?
actually affected everything in my life. The only time that I had any kind of peace was when I was sleeping. I couldn't drive. I couldn't go out to the store. I didn't go to a lot of events. I couldn't clean. I couldn't do regular things around my home. Yeah, it had a big effect on my life.
Hmm. Well, and since having care with Dr. Childs and Dr. Durr, what has improved?
Wow, everything. Everything has improved. And it goes back from, I went to, and this is true, when this first started, I went to so many doctors. I took medicine. I was up at the hospital. I actually even did acupuncture. From April through, I have been to several doctors, tried actually even some kind of therapy, which actually made me worse, believe it or not, because I could not move my head or my eyes. So everything has improved.
Hmm.
And it goes back to me saying when I first came in, when you write things down, tell a little bit about how you're feeling. I did ask Dr. Childs to please, can you get my life back for me? And I got to tell you, he's done that and more, and his staff, everything is so much better. I mean,
What an impact.
a huge impact,
Yeah.
a huge impact. And I got lucky because nothing was helping me at all. And my friend happened to see Dr. Childs on Facebook, I believe. And she immediately called me and said, you've got to look into this. So I did. I went online, and he hit on everything because it's a kind of I don't know if I want to say illness, but you're so down and out, and it's an everyday occurrence that you get tired of telling people, the same thing, how you feeling, but he hit on everything that was wrong with me, and I made the call, and I'm better for it.
Great. I'm
I'm
glad you
better
did.
for it.
I'm glad you did. Any thoughts on your experience in the office with the doctors, the staff?
Wow. I could say a lot about the doctors and the staff. And first thing I'd like to say is, they are second to none. And that is really the truth. From the time I made a phone call, I could feel that I felt at home. And they are professional and personable at the same time. Their concerns, dealing with you every day, taking care of you, I'd like to let them know the importance of their job to people like me, the impact that they have on us, and trying to make us well is just over and beyond. And I mean that from the heart. I really do.
Beautiful. Thank you so much. And Janet McAleer, much health.
Thank you so much, Donna. I appreciate all of you. I really do.
Thank you. Thank you again. I'm here with Ron Igeson. Hi, Ron.
Hi.
I'd like to ask you, what health complaints did you have prior to coming to the office?
Primarily, I had a balance disorder and severe vertigo, to the point where at times I would completely collapse on the floor.
Wow. And how long did you have this?
Actually, I think the problem started like 30 years ago with Meniere's disease, and I lost my hearing. But over the past 2 years, the balance issues and the vertigo seems to have become worse.
Ron, how did this condition affect, or what did it affect most in your life?
Well, it affected my whole life. I put my life on hold. I can no longer practice as a psychologist. I was afraid to go to restaurants or go to social events for fear that I would collapse and fall on the floor.
And since having your care with Dr. Childs and Dr. Durr, can you tell me what has improved?
Well, basically everything. I've gotten my life back. I haven't had a severe attack since treatment. My posture is better, my digestion is better. It's kind of like I'm a whole new person. Basically, I feel as though I've gone from feeling like I was 90 years old to now feeling like I'm 50.
And that's a big impact on your life.
A huge impact on my life.
Wow. Are there any other thoughts on your experience from or at our office, the doctors, the staff?
All the staff have been very warm, very caring, and very professional. From the time you come into the office until the time you leave, you feel like you're valued.
That's great. Well, thank you, Ron. And signing off.
All right, I'm here with Frank Scatini, a patient in our neurometabolic plan. Hi, Frank.
How's it going, Jamie?
All right. What health complaints did you have prior to coming in the office?
I had several. I'd been diagnosed with Meniere's disease, and I'd also had for years been taking Synthroid for my thyroid condition, or Hashimoto's as it turns out to be.
Mm-hmm.
Plus I had some general, not feeling well on a consistent basis and kind of lethargic issues.
How long were you suffering with those symptoms?
I'd had Meniere's for about 2.5, 3 years. It just showed up. I was deaf in my left ear, which also came up rather suddenly. And the only option that doctors really gave me was surgery to disable my left ear to stop my periodic vertigo and dizziness issues.
Oh, wow. So what did those symptoms affect the most in your life?
Pretty much every aspect of it. It was getting so bad at times that I would just be sitting there at a family reunion or at a party, and all of a sudden I'd start getting dizzy, and I'd have to sit down and stuff. So it really was affecting every aspect of my life at the time. It was making it difficult to work and just do general things.
Since having care with Dr. Charles and Dr. Durr, what has improved?
Several things. One, going through the metabolic aspect of it, of what my diet was, kind of helped address some issues. The other thing is the therapy really addressed my Meniere's to the point where now I actually can hear out of my left ear, which was a shock. And I did notice that and I've had challenges on my left side, which, through therapy has really significantly improved.
That's great. How was that impacting your life?
Now I pretty much do everything I could do before about 2.5 years ago. So I run, I basically do everything everybody else does. The only thing different is I have my diet significantly different than it used to be, which isn't always fun, but hey, it is what it is.
All right. Any other thoughts on your experience at the office of the doctors and the staff?
Yeah, no, I think the staff were outstanding. Everybody was really helpful, really willing to help me out, and they've really pushed me at times, which was really good. And it's really been a pleasure, being part of the program.
Excellent. Thanks so much.